are going to do the lumbar spine. So first I'm going to pull over a lumbar without. So I have my order, it's a lumbar without. I need to register my patient. So I've already screened my patient. They're changing their clothes. So while they're doing that, I'm inputting my patient's information. I'm on L-Spine Assist. I need to upload this so I have stock images to look at. So this is specifically so we have stock images to scroll through. Okay, so we're going to run this spine assist. I'm just going to keep hitting go. I want all of that to go ahead and run. So while this is running, I'm going to go get my patient from zone 3. I'm going to take them into zone 4 and get them set up. If you have sequences like this that don't run, you get the little working man, the pop-up, just go ahead and open it again and hit go. So I've got my patient set up in zone 4. So I'm going to come back to my console now. I'm ready to scan them. So now I need to pull over my Owens protocol. So now it's running my localizers. I pulled over my protocol. It's running the localizers. The first thing on my sheet that it says it wants me to do is to set up a T2 sagittal, and that's the first thing that pops up here. But it's popping up with a lot of rest slabs or saturation bands. Just highlight it. We're only going to use one. Okay, that's going to go anterior. So right here, this is thoracic spine. I'm doing lumbar. So I'm going to go into my view and go, and I want to make sure I'm pulling over my lumbar scouts. Okay. Siemens scouts the entire spine. So first it does cervical, then it does thoracic, then it does lumbar, and then it does a whole composed scout for you. So right here I can see it's my spine scout. There's 3 lines in front of it. That means that was the 3rd one. That's my lumbar. I'm going to pull this over. Go back into my view and go, and I'm going to do all the planes for lumbar. Okay, so I'm setting up a T2 sagittal. According to your lab manual, you need to have all of T12 vertebrae, and you're going to need to be through S1. Okay, so in order to get my slices, my field of view box, you're going to have to really zoom out. You're going to have to zoom out of your image to find it because it doesn't pop up there for us. So zoom all the way out and then zoom back in. It says the face direction, so we're doing a sagittal. It says this face direction is going head to foot. It's at 80%. I like to show my oversampling lines on so you can see where it's at, and I like to take my slice lines off so I can see better that I'm centered. Okay, I want to make this more of a rectangular box. So I'm going to change my field of view a little bit. Okay, so what I did is I made my field of view read at 220. I increased my field of view phase percentage to 128. So here I have L5, 4, 3, 2, 1, and I have all of T12, and here's my S1, S2. Okay, I'm going to center back here over the spine. I'm going to utilize this anterior rest slab. I'm going to angle. I have that descending aorta that's traveling down this way. My phase is going head to foot. I can angle this to help with some of that flow motion. Now there's all kinds of different things you can do. You can do a superior sap band as well. It's just going to depend on the technologist, your software, your vendor as to how somebody likes to place the different types of rest slabs. So maybe you're placing one superior, you're suppressing the flow going down. Maybe you'll see one, you can add another one. Maybe someone will place one inferior. So now you've got one superior and inferior. Okay. So you're suppressing your flow from coming down, your arterial flow coming down, your vascular flow coming up. That can help with some of that flow motion. Okay. There's different ways, just however you do it, and you're going to see it a lot of different ways, especially when you go out to clinic. And once again, it just kind of depends on the technologist that's doing the scan. So I have my field of view, I have my phase. This is telling me that I need a 4 thickness gap at 4 thickness at a 1 gap. So make sure you're double checking those parameters. 4 thickness, I have a 1 gap. You're going to want to scroll through your coronal reference image, and you want your slices to be centered in the middle of your cord, going parallel right down your cord. Okay. So these are my vertebral bodies, my intervertebral disc space right here. And you're not seeing the cord all in one shot, you're just seeing parts of it as you scroll through. So right here I'm centered right over the cord. And now you can see it as I'm scrolling through. You can see parts of the cord as we go up. Okay. At a bare minimum, you want to cover your vertebral bodies, your entire vertebral body covered from right to left. Some places will have you go all the way out to the transverse processes. So we're at a 4 slice thickness, 1 gap. I have 15 slices. If you wanted to go out farther, 17 slices is okay too. If you're catching, wanting to go into those transverse processes more. Okay. Says we're T2 weighted. Are we T2 weighted? Got a nice long TR, 3500, a TE of 98. Okay. If you want to check your turbo factor, you can go in. It's at 17. According to your book, that's a appropriate parameter. If you want to go up a little bit, take some of that time down, you can do that. So that's our sagittal for our lumbar. So I'm going to go ahead and hit go. I might bring that in just a little bit more. You want to be careful that you're not right on top of your vertebral bodies. This saturation, it's going to saturate out that tissue. It's going to create that dark band. Okay, so you don't want to create a dark band across anatomy that you might be looking at your vertebral bodies. And remember, we have an anterior longitudinal ligament that runs along the anterior aspect of these vertebral bodies. Just leave a little bit of space because sometimes you can have a little bit of bleed through. Now if I'm looking at my Owens sheet, my manual, I'm looking through it, am I going to need to run a T1 sagittal? I am going to need to run a T1 sagittal, but I'm not running it yet. So I don't want to hit go because I don't want to run it, okay? Because we're going to need to set that up yet. The next thing it's asking you to do is your T2 axial with 5 slabs going through your last 5 disc spaces. So I'm just going to pull that above my T1 sagittal and I'm going to open that up. Once again, I'm going to need to minimize here. I took my slice groups, I do need 5 slice groups. I took mine down to 1 because I don't want to pull 5 of them into this image all at the same time. So I just took it down to 1. Okay. I did do a better sagittal, so now I can pull that over to work off of. I have a field of view at 180. I'm good with that. I want to make sure I'm getting spinous process. I'm going to center right here posteriorly. You want to angle with the disc spaces. So this is my L5 S1 disc space. Make sure you angle with that. Phases going A to P. Make sure you have enough phase oversampling on that you're not going to get wrapped. We want to be at a 4 slice thickness and a 1 gap, so I need to make that adjustment. So I'm at a 4 and a 1. And I'm going to do 5 individual slices through each slice group. So that's my first slice group. Okay. Now I can add another one. So I'm going to angle this one through my L4, L5 intervertebral disc space. I'm at a 4-1 gap. I'm going to make that 5 slices. Now we have to be careful of crosstalk back here. And it looks like my crosstalk, I'm okay. My crosstalk is happening back here. It's not going through my spinal canal. So I should be good there. Now I'm going to add another slice group. I'm going to angle that through my L3, L4 disc space. Still at a 4 gap, or 4 thickness, sorry, and a 1 gap. Gonna make that 5 slices. Now I'm gonna add my 4th slab. Once again, I'm angling through that intervertebral disc space. That's my L2, L3 intervertebral disc space. still at 4. And here's my final slab. Or slice group. And I want to make that 5 slices as well. Okay. So I'm going through my L5S1, my L4, L5 disc space, L3, L4 disc space, L3, L2, L3, and then my L1, L2. So that's L5, 4, 3, 2, and 1. You're angling each of these individually through your intervertebral disc spaces. Make sure you're centering in the same spot on all of them, because this is your field of view. This is what your slices are covering here. And then they should be lined up over the cord over here on your coronal reference image. Everything should be centered over your cord. So as long as you're on your center slice of this sagittal reference image, this box is highlighted. Okay. You can right click and do shift to image plane. And now they've all lined up over the cord over here, so they're right to left. If you have a patient that has a real curvy spine, sometimes you're going in here and you're looking at the individual disc spaces, and you may have to do a slight angle on your coronal reference image as well. But this looks pretty good. Okay. So now I want to set these anterior rest slabs, and once again, different technologists do this different. A lot of times it depends on your software, what your images look like, as to how many saturation bands you're adding to your patient. You could do, our phase is going A to P, so I'm kind of taking a generalization here. So I've got these 3 slices. I've got that abdominal aorta that's running here anteriorly. So I'm looking at this slice group, and maybe I want to add another saturation band on. Oops. And maybe I want to place that one like that. Okay. So it's helping with some of this flow motion that's going to come from that abdominal aorta. You're going to have a lot of belly motion, peristalsis, all of that stuff that's going on down there. And our phase is going A to P. Okay. Are we T2 weighted? So this says it's a T2 axial. So it looks like I've got a TR of 860. So that is not appropriate weighting. So my TR and my TE are too low. We're not worrying about time yet. That's a lot of time, but we're not going to worry about that yet. We're just showing you the setup right now. Okay, so now I'm T2 weighted. I can double check. Oh, there we go. It's got a turbo factor of 3. So that's a turbo factor that you would typically use with a T1 weighted image. So I want to increase that. And then look how much that brought my time down. Okay. So that is your 5 slabs going through your last 5 intervertebral disc spaces for that lumbar. So I like that, so I'm going to go ahead and hit go. The next thing on your sheet, it's telling you to set up that T1 sagittal, okay? Well, you've already set up a T2 sagittal, so everything, all of your parameters except for your weighting parameters are going to match up. It's going to be the same field of view that you used before, same slice thickness, same gap, same number of slices, okay? You do have to reset this up. You cannot copy and paste like I'm doing right now. You will completely reset it up. And then once you get it all set up, you're going to look at the weighting parameters. Are you T1 weighted? Got a TR of 650, a TE. Maybe I want to bring that up slightly. But you're T1 weighted. So everything copies just like your T2 sagittal as far as your parameters except for your weighting, because this is a T1, so your weighting parameters are going to be different. So when you have that completely set up, you're going to go ahead and hit go. And then the last thing it wants you to do, it wants you to run that T1 axial, and this is going to be in a block fashion, okay? Our last axial, we had a field of view of like 180. This one's way too large. Look how large that is. We don't need it that big. So we can probably use that same field of view we used before. We're going to use a 4 slice thickness out of 1 gap. And then we're covering our last 3, the lower 3 disc spaces. So we know we don't need all of those slices. Might want to increase my phase oversampling a little bit. Our phase is going A to P. So here's my L5S1, L4, L5 disc space, and my L3, L2 disc space. I don't need to cover all of those vertebral bodies. I don't need to cover all of L3. I'm just making sure I get my L3, L4 disc space. And then I'm going to set this rest slab anteriorly because my phase is coming A to P. So I'm setting it anterior to my slice group right here. I'm going to want to make sure that I'm nice and centered over here on that coronal reference image. So my sagittal box is highlighted. I can highlight my slices right here, and I can right click and go shift to image plane, and that'll have me centered right over my cord. I am not T1 weighted. My TR is way too high, so I can lower that. So that is how you set up your block fashion for the lumbar, covering the last 3 disc spaces. And if you like it, you can go ahead and hit go.